Sí, el tema es que no, cuando me hablan en coreano alguien me pregunta, no, del coreano no hay. Es que pensé que el coreano era 제가 알려줬어요. 실시간
Muy buenas tardes para los asistentes en Colombia. Muy buenos días para los asistentes en Corea. Soy Yolisette Romero, soy médico pediatra del Hospital Universitario San Ignacio y de la Universidad Javeriana. Daremos inicio a la ceremonia del lanzamiento del proyecto Potenciando a la Atención Médica en Colombia. Ustedes tienen disponible la traducción si es necesario con los dispositivos que tienen enfrente. Este estudio de factibilidad de la transformación de la teleconsulta y la educación médica. A continuación, el himno de la República de Corea. Himno de la República de Colombia. Se dirige a ustedes el padre Luis Fernando Múnera, de la Compañía de Jesús, rector de la Pontificia Universidad Javeriana.
Buenas tardes, distinguidos invitados, señor embajador de la República de Corea, excelentísimo señor Bang Gin Lee y colaboradores de la Embajada de Corea. Doctor Sang-Hon Jeon, director general del proyecto. Instituciones médicas colaboradoras, socios tecnológicos colaboradores y demás invitados especiales. Para la Universidad Javeriana es un gran honor ser el anfitrión de la ceremonia de lanzamiento de un proyecto visionario. El proyecto de factibilidad de una plataforma para transformar la teleconsulta y la educación médica en Colombia, y yo me atrevería a decir en el mundo. Con una voluntad decidida y colaboración internacional, nos embarcaremos en un viaje hacia la transformación y la inclusión en el campo de la formación y la atención médica. Este proyecto, materializado a través de Health on Cloud, resuena con el compromiso de cerrar brechas en los servicios médicos y la educación en salud, fomentando la democratización de la tecnología para ponerla al servicio de la comunidad. Superar la disparidad en la atención médica, conectando a todos los que requieran atención con destacados profesionales médicos a nivel global y facilitando el servicio y facilitando el acceso a servicios médicos de alta calidad. No solo es la visión de Health on Cloud, es también el compromiso de la Universidad Javeriana desde su misión como universidad integrada a un país de regiones, con perspectiva global e interdisciplinar que promueve la responsabilidad social. Nos identifica la promoción de una cultura en una perspectiva crítica e innovadora para el logro de una sociedad justa, sostenible, incluyente, democrática, solidaria y respetuosa de la dignidad humana, como lo dice nuestra misión. Asimismo, la Facultad de Medicina y el Hospital Universitario San Ignacio conforman un centro académico de salud en el cual se integran la educación en salud, el cuidado del paciente y la investigación con un enfoque multiprofesional y multidisciplinario. Comparten los pilares de la excelencia, la calidad en la educación médica y la prestación de los servicios de salud, atendiendo a la misión de la formación de nuevas generaciones y el fomento de la investigación y la innovación médica. Este proyecto nos une en el propósito de servir a las comunidades. En un área definida por la conectividad, este proyecto se esfuerza por ampliar el alcance de la atención médica a todos los rincones del territorio nacional. Su objetivo es derribar barreras y eliminar disparidades, asegurando que la experiencia médica esté al alcance de todos, sin importar su ubicación geográfica. Esta alianza no se limita a un memorando de entendimiento o a un acuerdo entre las partes. Es un testimonio de la fortaleza de la solidaridad global ante los enormes desafíos en el ámbito de la salud. El vínculo con Corea, país con el que tenemos una relación de fraternidad, de compromiso desde hace muchísimo tiempo, subraya nuestra apertura a la cooperación internacional, fomentando relaciones que trascienden fronteras en la búsqueda de comunidades más saludables. Nos sentimos profundamente honrados de trabajar en este proyecto con la Fundación Santa Fe de Bogotá, un hospital universitario reconocido por su compromiso con los más altos estándares de calidad. Nos enorgullecen las excelentes relaciones que hemos forjado con esta institución y allí reconocemos a muchos de nuestros egresados de la Facultad de Medicina, como el doctor Henry Gallardo, director de la Fundación, y el doctor Roosevelt Fajardo, director médico de la misma. Hoy tenemos el honor de contar con la presencia del doctor Sanjon Jeon, quien lidera esta empresa transformadora. Él es reconocido médico cirujano de tórax, figura destacada en el panorama médico de Corea, director de cirugía torácica y cardiovascular en el reconocido Hospital Universitario Bundang de la Universidad Nacional de Seúl. Su experiencia y dedicación al avance médico ejemplifican el espíritu emprendedor que con voluntad política y capacidad de gestión inspiran a nuevas generaciones. Esta ceremonia pone de manifiesto las bondades de un trabajo colaborativo y la consolidación de una red internacional. Mientras iniciamos este prometedor viaje, quiero reconocer el esfuerzo colectivo del equipo de Corea, Reino Unido, Estados Unidos, Singapur y Colombia. Extiendo también mi más sincero agradecimiento a cada uno de ustedes por ser parte de esta ocasión histórica, en particular a la Facultad de Medicina y al doctor Carlos Gómez Restrepo por su liderazgo visionario en el proyecto. El futuro que visualizamos es uno en el que la atención médica no conoce límites, donde la experiencia trasciende fronteras y donde cada individuo tiene acceso a los servicios médicos de la más alta calidad. Avancemos juntos con determinación para convertir esta visión en realidad. Muchas gracias.
Siguiente saludo de bienvenida, doctor Sanjun Jeong, investigador principal del proyecto, presidente de la Sociedad Asiática de Cirugía Cardiovascular y de Tórax. Gracias, doctor Jeong.
Good evening. I'm honored and even excited to be here in Colombia today with so many supporters and esteemed guests. The respected rector of the Javeriana University, Father Luis Fernando Bonera, and Dean of Medical School, Professor Carlos Gomez, and Professor Roosevelt Bernardo from Santa Fe, Director of Medicine, and officers from Ministry of Health and the City of Bogota, and Mr. Juan Carlos Caiza, former Colombian ambassador to Korea, and His Excellency General Wang Lee, Korean ambassador to Colombia, and Mr. Tae-sang Kim, CEO of the LGCNS Colombia, and our distinguished guests. We also extend our warm welcome to participants joining us online from Korea, UK, USA, and Singapore. Welcome to the launching ceremony of our value project, Empowering Colombian Healthcare. Today marks a momentous day as we gather to celebrate the unveiling of the groundbreaking project that promised to revolutionize the healthcare paradigm. Over the years, we have recognized the scientific challenges that hinder some of our citizens from accessing primary health care. Factors such as geographic remoteness and economical constraints have made it difficult for certain individuals to reach healthcare facilities. This concern is especially critical for severely ill patients with conditions such as cancer, heart disease, and neurological disorders. Additionally, we understand the significance of continuous professional development for our medical professionals and the students. This commitment ensures they remain at the forefront of medical knowledge and practices, enabling them to provide the best possible care. This dedication lies at the heart of our mission to build a healthier world. Our shared mission is to minimize global healthcare disparities through cutting-edge information communication technology and an extended reality metaverse environment. I stand before you with immense pride and excitement as we embark on the journey of the digital healthcare transformation in our beloved nations of the Colombia and Korea. It is with great pleasure that we unveil two pivotal components of our healthcare transformation. Firstly, we are introducing a state-of-the-art metaverse-based telemedicine system that bridges the gap between our citizens and the healthcare services. This technology ensures that even those in remote or challenging areas can access medical consultation and support from qualified healthcare professionals right from the comfort at their homes. Secondly, we are thrilled to announce a collaboration with renowned global doctors and the medical experts. Their expertise will complement and enhance knowledge sharing among Colombian medical professionals, enabling them to provide world-class care right here in Colombia. By addressing these challenges head-on, we aim to create a more inclusive and a resilient healthcare system, leaving no one behind. Our goal is to provide quality healthcare accessible to all, regardless of location or economical circumstances. Together, we will build a brighter future for healthcare in Colombia and beyond. I extend my heartfelt appreciation to all those who worked tirelessly to make this project a reality. Your dedication and passion for improving the well-being of our citizens are truly commendable. As we embark on this transformative journey, let us remember that it is a testament to our collective strengths and determination. Together, we can overcome obstacles and create a healthier, more vibrant globe, starting from Colombia, where the well-being of every individual will be our top priority. Thank you, and let us embrace this new era of the healthcare transformation with optimism and unity.
Damos la palabra al director general del Ministerio de Salud y Bienestar de la República de Corea, Oficina de Política de la Industria de la Salud, señor Eun-jun Jung.
Greetings from Korea to all of you. My name is Eun-jung Jung, the Director General of the Bureau of Health Industry Policy at the Ministry of Health and Welfare of the Republic of Korea. Thank you for your invitation to participating in today's event. It is my honor and pleasure to be able to speak at this momentous event. First of all, I would like to extend my sincere congratulations on the official launch ceremony for the Empowering Colombian Healthcare Feasibility Study project. I would also like to send a special thanks to Mr. Park Ok-sung, the CEO of Health on Cloud, and the dedicated professionals and the staff members of Javeriana Hospital for organizing this event, and to all the collaborators on this project. As an innovative project with the support from the IDB, this feasibility study is expected to bring about the digital transformation of the Colombian healthcare system. I'm truly proud that Korean hospitals and corporations are participating in the development of this important project. The COVID-19 pandemic has triggered the acceleration of the digital transformations in healthcare, and we needed to put digital healthcare policies as a priority in our countries. The national capacity in digital healthcare will be an essential indicator for the healthcare technology development in each country, and will play a vital role in raising patient satisfaction and accessibility and improving health equity in healthcare services. Korea is a leading nation in the world in IT and has a high international competitiveness in digital healthcare with excellent technology and abundant experiences in the state-of-the-art ICT-based teleconsulting and education platforms. Seoul National University, Bundang Hospital, and the Asan Medical Center, equipped with outstanding medical professionals and researchers, are assisting the Colombian professionals and will help the national capacity of the Colombian healthcare system. In closing, I hope the fruits of this project will be utilized to contribute to the sustainable development of the healthcare industry in South America and the world, and to a closer relationship between Korea and Colombia. I wish you all the best for the successful completion of this project. Thank you very much.
Se dirige a ustedes el señor embajador de la República de Corea en Colombia, Won-gu Lee. Bienvenido, señor embajador.
Hola a todos. Soy Won-gu Lee, embajador de Corea en Colombia. 존경하는 루이스 페르난도 무네라 하이베라나 대학 총장님, 카를로스 고메스 하베리아나 의과 대학장님, 후안 카를로스 가이사 전 주한 콜롬비아 대사님, 그리고 전상훈 서울대 교수님, 그리고 귀빈 여러분, 오늘 콜롬비아 원격 헬스케어 시범사업 착수식에 참석하게 되어 매우 기쁘게 생각합니다. 사업과 관련된 콜롬비아 보건부, 보고타 시정부, 하베리아나 대학, 산타페 병원, 국내 병원과 글로벌 기업 등의 모든 관계자 여러분께도 감사의 말씀을 드립니다.
Honorable Padre Luis Fernando Munera, rector de la Pontificia Universidad Javeriana, estimado Dr. Carlos Gómez Restrepo, decano de la Facultad de Medicina de la Pontificia Universidad Javeriana, estimado señor Juan Carlos Caiza Rosero, ex embajador de Colombia en Corea, estimado Dr. Chon Sang-hun, profesor de Hospital Universitario Nacional de Seúl, señoras y señores, es una inmensa alegría para mí estar aquí con ustedes para inaugurar el proyecto Empowering Colombian Healthcare. Aprovecho esta ocasión para manifestarle mi más sincero agradecimiento al Ministerio de Salud de Colombia, la Alcaldía de Bogotá, la Pontificia Universidad Javeriana, la Fundación Santa Fe de Bogotá, los centros médicos y las empresas globales que nos han prestado su valiosa ayuda.
우리는 최근까지만 해도 코로나 팬데믹 상황 아래 유례없는 보건 의료 위기를 겪었습니다. 이 가운데 의료 시설에 대한 접근이 어려운 지역에 거주하거나 경제적으로 곤란한 사람들은 불행하게도 더 큰 어려움을 겪어야만 했습니다. 여기서 원격 의료시 의료 시스템 구축의 필요성은 한층 더 강조되었습니다.
Hasta no hace mucho nos vimos sacudidos por una crisis sanitaria sin precedentes que se desató por la pandemia COVID-19. Con la evolución de este virus, aquellos que viven en zonas vulnerables con un acceso limitado a instalaciones médicas y escasos recursos económicos se vieron expuestos a grandes dificultades, lo cual hizo más relevante fortalecer el sistema de telemedicina.
근본 사업은 이러한 시대적 요청, 메타버스와 같은 첨단 기술의 발전, 그리고 국경을 초월하는 통합의 시대와 같은 선상에 있다고 할 수 있습니다. 사업을 통해 디지털 원격 의료 상담 플랫폼과 의료 교육 플랫폼을 각각 구축할 예정입니다. 이를 통해 모든 사람들이 물리적 거리나 경제적 여건에 관계없이 높은 수준 글로벌 의료 서비스를 받게 하는 것을 목표로 하고 있습니다.
Este proyecto, que se realiza en tiempos de integración global, busca atender las necesidades surgidas por los cambios y va de la mano con las tecnologías avanzadas como el metaverso. Tenemos planeado mediante este proyecto construir una plataforma digital de teleconsulta médica y otra de educación médica. Con ello, esperamos lograr que toda la gente pueda tener acceso a los servicios médicos globales de calidad, independientemente del lugar en que se encuentre y su situación económica.
이와 관련해서 한국 최고의 의수를 지닌 전상훈 서울대병원 교수님은 콜롬비아 내 디지털 의료 시스템 수요와 관련 기관의 적극적 추진 의지를 반영하여 근본 사업을 진행해 왔습니다. 그리고 공공기관과 기업들의 후원을 이끌어냈습니다. 사업의 원활한 수행을 위해 콜롬비아 정부와 하베리아나 대학 그리고 산타페 병원 그리고 모든 유관기관 기업에서 지속적으로 관심을 가져줄 것을 요청드립니다.
Al impulsar este proyecto, el doctor Chon Sang-hoon tomó en cuenta la demanda actual del sistema médico que tiene Colombia y la fuerte voluntad de las entidades participantes. Además, se pudo conseguir la financiación de entidades públicas y privadas. Para que este proyecto pueda resultar exitoso y productivo, esperamos seguir contando con la amable atención del gobierno colombiano, la Pontificia Universidad Javeriana, así como de todas las entidades y empresas que participan.
여러분이 아시는 것처럼 콜롬비아는 한국 전쟁에 전투병을 파견한 중남미 유일의 국가입니다. 양국은 역사적으로 혈맹이자 형제 국가입니다. 한국 정부는 2016년에 한콜 우호재활센터를 건립하였고 이는 상위 군경의 사회 복귀를 위해 크게 기여하면서 양국 우위의 상징으로 자리 잡았습니다. 이러한 맥락에서 한국 정부는 콜롬비아 국민의 보건 의료 증진을 위한 협력에도 지속적으로 관심을 가져왔습니다.
Como ustedes saben, Colombia es el único país latinoamericano que envió a sus combatientes a la península coreana durante la Guerra de Corea. Gracias a este hecho histórico, somos países hermanos unidos por lazos de sangre. El Centro de Rehabilitación Inclusiva que el gobierno coreano construyó en 2016 para contribuir a la reintegración social de los soldados y veteranos lesionados se convirtió en el símbolo de la amistad de nuestros países. En esta línea, Corea también ha mantenido su interés por promover los proyectos para la salud del pueblo colombiano.
근본 사업이 성공적으로 완료되어 시범 사업뿐만 아니라 본 사업으로 이어지고 그리고 다른 중남미 국가들에도 전파될 수 있기를 기원합니다. 아울러 다시 한번 이 자리에 참석해 주신 모든 분들께 감사드립니다.
Espero que este proyecto coseche muchos éxitos, de modo que después de la fase piloto, que es proyecto de factibilidad, podamos seguir con proyectos más amplios y que se difundan los conocimientos a otros países latinoamericanos. Una vez más, les agradezco por acompañarnos el día de hoy.
Muchas gracias, señor embajador. Damos la palabra al doctor Juan Carlos Caiza, ex embajador de Colombia en la República de Corea.
Muy buenas tardes, apreciado padre Múnera, qué gusto estar aquí compartiendo con usted. Señor decano, doctor Gómez, qué placer estar aquí. Señor embajador, señor Lee, es un placer saludarlo nuevamente. Apreciado amigo John, qué gusto que esté visitando. Un saludo a todos, señoras y señores. Yo quiero mencionarles que en estos años que han transcurrido de las 60 años de las relaciones entre Colombia y Corea, fue muy gratificante en el año 2021, hace 2 años, poder cambiar la relación de Colombia y Corea de una relación que se soportó en el apoyo alrededor del conflicto a una nueva relación donde fuimos aliados en la guerra y ahora somos socios en la innovación. En esa oportunidad tuve el privilegio de conocer a John cuando era presidente del Seoul National University Hospital, quien ya venía con el camino o el puente del Banco Interamericano de Desarrollo, conociendo Colombia, y con la visita del señor presidente, expresidente Duque, se pudo firmar ese nuevo lazo, ese nuevo canal en el sector salud y pudo conocer estas tecnologías que hoy se nos están presentando. Fue una oportunidad también, como exalumno javeriano, abogado javeriano, poder tener contacto con el doctor Gómez y poder hacer ese puente para que este proyecto se haga realidad, tanto con la Universidad Javeriana como la Fundación Santa Fe. Quiero mencionar, señor embajador, que nos encontramos con usted y con usted, señor rector, en las mejores manos para que este proyecto salga adelante. Mencionarles que viene unos años de mucha colaboración y Colombia, que es un país biodiverso, Colombia, que es un país que necesita esta alta tecnología en nuestras regiones, va a ser una de las mejores prácticas para que muestre Corea y el mundo en América Latina. Es un placer estar aquí y es un placer acompañar a mi amigo John y espero que este tipo de ejemplos puedan aprovecharse en otros países del continente. Muchas gracias.
Muchas gracias. A continuación, presenta su saludo el doctor Ralph McKinnon, director de Smart Hospital Alliance.
Dear ambassadors, ministers, distinguished speakers and guests, ladies and gentlemen in Colombia, the Republic of Korea, Singapore, United States and the UK. It's a great honor to join you and pass on my congratulations on this momentous day. I'm Professor Ralph McKinnon. I'm a pediatric anaesthetic and critical care doctor at Royal Manchester Children's Hospital in Manchester in the United Kingdom. And as chair of the Smart Hospital Alliance, I offer a huge warm welcome to our colleagues from Colombia. As an alliance of healthcare professionals, we look forward to working with you, learning from you and learning with you. The Smart Hospital Alliance is a growing global network aiming to leverage technology to decrease worldwide inequalities in healthcare provision by promoting innovation, research and education in extended reality and the metaverse. We're already successfully on our path as a global community of practice, in the real sense of the word of global community of practice, a community of practice that mutually engages, shares resources, and is jointly accountable. We are mutually engaging daily, be it by clinical trials or even yearly in terms of international metaverse healthcare conferences. We share resources in terms of developing projects based on international cross-border grants and developing innovations to directly enhance patient care and patient safety. These include platforms that you will hear about, applications, and educational interventions. And being jointly accountable, we aim to produce the highest quality output possible and to be as inclusive for everyone. Today, we have taken another great step on our pathway, joined by our Colombian colleagues. And with this, we are even closer to our aims. So on behalf of the Smart Hospital Alliance, I congratulate you all. Thank you.
A continuación, tendremos las presentaciones de las instituciones médicas que colaborarán en el proyecto. Se dirige a ustedes el doctor Carlos Gómez Restrepo, decano de la Facultad de Medicina de la Pontificia Universidad Javeriana y líder del proyecto en el Centro Académico de Salud, Facultad de Medicina, Hospital Universitario San Ignacio.
Agradezco inmensamente a nuestros invitados, al profesor John, profesor, amigo y compañero, al señor embajador, a todos los acá presentes, al igual que a todos nuestros aliados de los Smart Hospitals. Este día es un día muy especial para la universidad y para la salud de Colombia. Pienso que se da un paso muy importante para mejorar la salud de los colombianos, para implementar todo lo digital en lo que nos falta y podemos mejorar, al igual que en toda la parte de educación. se preparó un video de 4 minutos que vamos a presentar con el fin de que tengan una idea de lo que se hace en la universidad y en el Hospital Universitario San Ignacio, que es nuestro aliado especial acá en compañía del director, el doctor acá presente, Julio César Castellanos, y el director científico del hospital. Les pido que coloquemos el video. Muy amables.
Pontificia Universidad Javeriana is a canonical juridical entity established by the Congregation for Catholic Education 400 years ago and guided by the Society of Jesus. It is a private institution that excels in providing education, conducting research, and offering services as an integrated institution within a regionally diverse country. With 18 faculties, 23,000 students, and more than 230 programs, it embraces a global interdisciplinary perspective and aims to provide comprehensive education for individuals distinguished by their high levels of human, ethical, academic, and professional performance. Regarding our Faculty of Medicine, it was founded in 1942. We offer 47 academic programs and 39 medical specialties. Our offerings extend to 4 master's degree programs in clinical epidemiology, biostatistics, school mental health, and education for healthcare professionals. Additionally, we have 2 PhD programs in neurosciences and 1 in clinical epidemiology. More than 1,700 students are affiliated with our faculty. We proudly hold the distinction of being the first Faculty of Medicine in Colombia to achieve a decade of high-quality education accreditation. Our esteemed faculty includes 240 professors, 50 adjunct professors, and 430 adjunct clinical professors. We encompass 14 departments and 2 institutes. The Institute of Human Genetics holds special importance in Colombia and has expanded beyond its disciplinary axis, venturing into various fields of knowledge. Additionally, the Institute of Aging is an academic unit with over 20 years of experience focused on interdisciplinary research on aging and old age, its possibilities and issues. It operates under the Faculty of Medicine and maintains close ties with the Hospital Universitario San Ignacio, particularly with the Geriatrics Unit and the Center for Memory and Cognition, Intellectus. Our impact in terms of research is considerable. Of the 15 research groups we have, 5 have been recognized in the A1 category, the highest recognition by the Ministry of Science, Technology and Innovation. Our strong networking spans numerous countries and began with the International Network of Clinical Epidemiology in the early 90s. Hospital Universitario San Ignacio, linked to our university, was born alongside the Faculty of Medicine. It represents a genetic connection between the faculty and the hospital as an academic health center. It has evolved and is now accredited by ICONTEC since 2016. It's recognized as a university hospital by the Ministries of Education, Health, and Social Protection since 2017. The hospital's focus on comprehensive medical care, guided by human ethics, safety, and efficiency, reflects its commitment to education and research. In 2022, we witnessed over 280,000 appointments, including external consultations, oncology, and palliative care. We conducted over 45,000 teleconsultations. We celebrated 17,000 hospital discharges. We also performed a total of 16,000 surgeries, each symbolizing hope and healing. The hospital is equipped with 303 hospital beds, 32 intensive care beds, and 8 pediatric intensive care beds. We are prepared to face any medical challenge. The impact of Hospital Universitario San Ignacio is significant. In March 2022, Newsweek ranked us among Colombia's top 5 hospitals, a testament to our unwavering commitment to excellence. We were also honored with the International Business Management Merit Award in 2021 for our dedicated care during the pandemic. The Faculty of Medicine and Hospital Universitario San Ignacio are committed to academic excellence, the country, and the future of healthcare.
Damos la palabra al doctor Roosevelt Fajardo, director del Eje de Educación y Gestión del Conocimiento del Hospital Universitario Fundación Santa Fe de Bogotá.
Muchas gracias. Buenas tardes. Yo tengo unas breves palabras, señor rector Luis Fernando Munera. Gusto estar acá en mi casa. Acá sentado frente al Hospital San Ignacio se venían muchas memorias. Doctor Castellanos, doctor Grueso, doctor Gómez, doctor John, señor embajador, autoridades de la República de Corea, de la Embajada, de la Universidad Javeriana. Para la Fundación Santa Fe es un privilegio haber sido invitado a formar parte de este proyecto y además haber sido invitado de la mano del Hospital San Ignacio, con quien tenemos las mejores relaciones, y con la Universidad Javeriana de muchos años. Como decía el padre Munera, muchos egresados de medicina y de posgrado de la Universidad Javeriana trabajamos en la Fundación Santa Fe. Así que es un gusto para nosotros poder tener esta oportunidad de trabajar con ustedes en este proyecto. La pandemia nos enfrentó a enormes desafíos e hizo que la telemedicina en muchos sitios floreciera. Sin embargo, un país como Colombia sigue teniendo enormes desafíos en llevar asistencia en salud a poblaciones muy remotas. Nosotros creemos que un proyecto como este puede abrir muchas puertas y generarnos oportunidades para poder crecer realmente en telemedicina en un país tan extenso como Colombia, en donde sabemos que el 65% de los especialistas están en las 3 ciudades principales más grandes de Colombia. De tal manera que de parte de la Fundación Santa Fe, todo el compromiso para que esta primera fase del proyecto de factibilidad sea exitosa y podamos llevar esto a un mayor nivel, a una mayor magnitud, para poder realmente impactar en la salud de Colombia, que es la misión de la Fundación Santa Fe Bogotá, y qué gusto que este proyecto sea de la mano del Hospital San Ignacio y la Universidad Javeriana. Muchas gracias.
Damos la bienvenida al evento al doctor Sergey Kim del Hospital Bundang de la Universidad Nacional de Seúl.
Hello, can you hear me? Okay. Okay, buenas tardes, Colombia. Good morning, ladies and gentlemen, distinguished guests. Nice to meet you. My name is Sergey Kim. I am a professor at International Health Care Center of Seoul National University Bundang Hospital. It's a great honor for me to introduce you to our hospital. The history of Seoul National University Hospital started from the end of 19th century as Chejong-won, which was the first national hospital of Korea. In 1978, it was established a special corporation, Seoul National University Hospital. It is our main hospital, and we is the first branch of Seoul National University Hospital. We opened in 2003 as the world's first full digital hospital, which started work without paper and film at that time. In 2010, we have got a stage 7 of HIMSS analytics. At the time, we were a first hospital with HIMSS stage 7 in the world outside USA. Now we have clinical base, medical research facilities, and education infrastructure in one place. In 2019, we, for the first time in Korea, opened a healthcare innovation park. It's a hub for collaboration between businesses in healthcare, biology, engineering, and information technology with BSL's Level 3 Animal Lab. We are publishing more than 1,100 SCI level research papers every year. In near future, we are planning to open Korea's largest hospital with 342 beds dedicated to diagnosing and treatment infectious disease, which will be a command center of infectious disease response covering more than 50% of Korean population. More than 5,500 staff members working in our hospital. We have 1,335 beds, 6 ICU units, NICU emergency department with 42 beds, and 39 operation rooms in our operation theater. This is our hospital statistics. Every day we have more than 6,700 patients in our outpatient clinics. It is about more than 1.5 million visits a year. Average daily bed occupancy 90-95%. Average length of stay 6.3 days. And now we do more than 170 operations a day, or about 43,000 a year. 35 clinical departments and 12 specialized centers provided excellent medical service to our patients. In 2018, our hospital first in Korea published quality indicator-based outcomes book. It was Professor John's idea. If you go to our website, you can see our clinical outcomes for various diseases, especially our excellent results of laparoscopic, thoracoscopic, and other types of mini-invasive surgery. One of the most famous things in our hospital is our own HIS. We call it Best Care. Our hospital is the world's first and best digital general hospital. HIS was created by our medical professionals. The system combines the patient's medical chart, PACS images, doctor's order, and all office work of the hospital. It is very convenient because you can access to this system in any time, in any place, and with any electronic devices. About our Global Medical Academy, we are running Global Medical Academy for training, education, and fellowship for doctors from foreign countries. Our mission is to contribute to the advancement of global healthcare through world-class education, research, and patient care. Every year, the number of international trainees grew up. It decreased during pandemic time, but now start to increase again. There are many kinds of programs, clinical. We have clinical observership and life surgery for physicians and surgeons, Leadership Academy for chief officers and CEO of medical institutions, Nursing Academy for education of nurses, and etc. During Corona pandemic, we provided online education program because, as you know, it was not possible to travel abroad. In 2021, Central and South American education was conducted using virtual technology. For example, participants could see our hospital facilities through hospital virtual tour and something like that. Also, in the end of 2022, we hosted and organized IDB and Colombia Health Department Digital Health Study Trip. And in this spring, we successfully held a World Bank and Caribbean Health Department study trip. And in the end of my presentation, I would like to share with you greetings from the CEO and president of our hospital, Professor Jong-Han Song. Oh, really? Oh my God. 여보세요?
You have to share again.
쉐어를 그거 어떻게 하지?
You have to stop sharing and share again if you could, please.
어떻게 하는 거죠? 네. 아하. 법인 중지. 공유. 잠깐만. 할 수 있나? 아. 잠깐만.
Okay. That's okay. We can move on.
Okay.
Thank you.
Se dirige a ustedes el
I'm
doctor.
sorry.
Se dirige a ustedes el doctor In-ho John, director de ASAN Medical International.
Good evening to you all. This is Professor In-ho John, Director of ASAN Medical International. On behalf of ASAN Medical Center, it is great pleasure and honor to collaborate in this great project with esteemed institutes of Colombia and Korea. ASAN Medical Center was established back in 1989 by the late founder of Jung Ju-young, who is also the founder of Hyundai Group, with the spirit of helping the underprivileged of our society and make a better, healthier world. With only a history of 34 years, we have grown up to become the largest and the best hospital in South Korea, specializing in the field of cancer, heart, and transplantation. ASAN Medical Center, Dr. Kim, can you stop your sharing, please? ASAN Medical Center launched the telemedicine service during the COVID pandemic. And last year, we performed more than 200 cases of video consultation for patients from all over the world. As you're all aware, telemedicine has multiple advantages. The most important thing is to provide the best and optimum medical advice who cannot be available in their own local country, so that we saved number of lives during the pandemic period. Joining this project is a great opportunity to extend our founding spirit globally, advancing medical education and better patients' care, so that we can reach digital transformation in the field of healthcare by collaborating with these honorable institutes. I believe this project empowers us to collectively sculpt a healthier world, and I stand very, very thrilled and excited and grateful to be a part of this international project, and hope this study can share a new pathway toward innovation in a global healthcare. Ladies and gentlemen, I would like to share I was requested to share a short video clip so that you can have an idea on what is happening in ASAN Medical Center. Please.
We are a hospital giving hope to severely ill patients, both at home and abroad, with average 15,000 outpatients a day. Also, we operate 2,700 beds 24 hours a day and perform around 72,000 sophisticated surgeries a year. As the best hospital for surgery and Korea's most admired hospital, AMC contributes to medical advancement based on leading medical skills and patient-centered care system. In addition, AMC is the first private hospital in Korea to open a Center for Infection Control, which is operated in a separate building specialized in infectious diseases. AMC is equipped with a safe medical environment that can immediately respond to infectious diseases. Organ Transplantation Center of ASAN Medical Center has the largest number of liver transplantations performed in the world with the highest survival rates. Since its first successful heart transplantation in Korea in 1992, AMC has been the leader of heart transplantation. Also, AMC is a pioneer in the field of high-risk organ transplantation, achieving excellent performance in kidney and pancreas transplantation, as well as performing 1 out of 4 lung transplantations in Korea. AMC Intensive Care Unit is equipped with world-class facilities supporting the performance of sophisticated surgeries and treatments, raising confidence in AMC's medical services. Heart Institute of ASAN Medical Center is a leader in the development of cardiology at home and abroad, offering specialized medical services including diagnosis, treatment, prevention, and rehabilitation of cardiovascular diseases. AMC Cancer Institute leads customized cancer treatment for patients, based on a multidisciplinary care system where specialists from various fields gather in one room to treat a patient. we provide optimized treatment for each patient. Children's Hospital in Asan Medical Center provides age-specific treatment from newborn babies to adolescents and performs AMC's high-quality medical service. Asan Medical Center grows further through educational programs. As a teaching hospital of the University of Ulsan College of Medicine, AMC provides students with greater opportunities to reinforce their capabilities. Also, Asan Medical Center continuously improves capabilities of its members by offering overseas training programs for nurses and employees. As a part of the Asan in Asia project, AMC's global educational activities include educational programs for local medical professionals, transfer of medical skills, and volunteer work, helping medically underdeveloped countries in Asia to achieve medical self-reliance. AMC's growth engine for the future, Asan Institute for Life Sciences. Growing into a medical cluster where basic translational clinical research is performed through cooperation with leading local and overseas research institutes, and the outcomes are put in practice in one platform. Based on its outstanding medical professionals and abundant clinical resources, Asan Institute for Life Sciences carries out major researches for the bioindustry of the future, shaping a better future of AMC. Asan's spirit of hope and sharing expands to the world. Visiting medically underserved rural areas and looking for sick neighbors, Asan Medical Center has been fulfilling its spirit of sharing through medical services. This beautiful journey continues to reach our neighbors around the world. With a social contribution beyond borders and a win-win management to grow together, Asan Medical Center fulfills its respect to life and love for mankind. With love beyond leading careers and world-class medical skills, AMC brings a new era of global medicine. Leading the future of health. Asan Medical Center.
Thank you very much. Thank you.
Nos acompaña por parte del Veterans Healthcare Medical Center, Dr. Kun Jung-ju.
Korea's model public health care facility serves veterans and their families and is also responsible for the health of the public. We are the Veterans Health Service Medical Center. As the result of countless efforts and developments to acquire the expertise to conduct high-standard treatments for severe conditions, the Seoul Veterans Hospital's pivotal role among the 6 national veterans hospitals was recognized, and it was promoted to become the Veterans Health Service Medical Center in September 2011. In February 2014, the Veterans Health Service Medical Center was renovated and expanded to become a large, high-tech hospital with 1,400 beds. The Veterans Health Service Medical Center has cutting-edge medical devices such as the Da Vinci robotic surgical system, linear particle accelerators, and PET-CT, along with expert systems designed to provide testing and treatment in an accurate and prompt manner. Professional treatment centers such as robotic surgery, AI cancer, cardiovascular, ophthalmology, vascular intervention, pain, decubitus ulcer, and diabetes and endocrinology centers are being operated to provide advanced and detailed services along with approximately 30 departments. Dental Hospital is planned to be newly opened in 2023 to provide improved dental care services to patriots and veterans and local residents, with 6 departments, including the prosthetics department and newly found facilities, an implant center and a scaling center. The Veterans Health Service Medical Center is the only independent medical facility that provides all of the following services: acute care hospital, rehabilitation center, dental hospital, convalescent hospital, and a hospice palliative care center. By establishing connections with regional veterans hospitals and consigned hospitals, the Veterans Health Service Medical Center has completed a veterans healthcare delivery service that provides interdisciplinary medicine fit for different disease cycles. The center provides the best rehabilitation therapy in Korea with the introduction of professional robotic rehabilitation systems, which are combined with traditional treatment-centered methods such as aquatic therapy room, exercise therapy room, and the Center of Assisting Devices to form a comprehensive system. The Veterans Convalescent Hospital, which has 400 beds, has become a top-class convalescent hospital in Korea by establishing a multidisciplinary care system between the Veterans Health Service Medical Center and the Rehabilitation Center to provide comfortable hospitalization environments, along with specialized treatment for geriatric illnesses. Founded in 2018, the Veterans Medical Research Institute bolsters veterans medicine research capacities. In addition, it manages the Biobank, a bank of human biological material, to carry out professional medical research projects tailored to the characteristics of geriatric illnesses and diseases suffered by patriots and veterans. Prosthetics and Orthotics Center, equipped with the latest equipment and top-class experts for various types of assisting devices, supports the swift recovery and successful return to everyday life by producing and providing tailored assisting devices to the aforementioned veterans, disabled persons, and other patients. The Veterans Health Service Medical Center contributed to establishing the National Prevention Network for various national crisis situations, such as the novel influenza virus, MERS, and COVID-19 by setting up infectious disease wards and exclusive beds for critical infectious disease patients. We'll continue to improve ourselves as the representative public healthcare facility of Korea and provide highest level of medical services not only to the veterans and their families, but also to all citizens in Korea. Veterans Health Service Medical Center.
Good evening, Colombia, and good morning, Korea. It is a great pleasure to take part in this project, which seeks to transform and empower the Colombia's healthcare system using our collective knowledge and the highest technological means at our disposal. As we have seen in our introductory video, our institute, the Veterans Health Service Medical Center, serves veterans who have served our nation, including during the Korean War. Our relationship with Colombia dates back to the Korean War 70 years ago, when Colombia was the only one country from South America who sent troops and participated in defending our nation. Due to such dedication from the great Colombian veterans, Korea has become a prosperous, high-tech country with outstanding medical and educational foundations. We are more than delighted to have this opportunity, another great collaboration between our two countries in such a cutting-edge area of telemedicine. On behalf of our institution and those dedicated to this project, let me say that I am eager to see this project succeed, and I am also excited as to where it will lead us. So congratulations once again on the kickoff, and let's get started. Thank you.
A continuación, después de estas presentaciones de las instituciones médicas que hacen parte de esta gran alianza, damos la palabra al doctor Won Yi Lee, quien hace la introducción del proyecto. Bienvenido, doctor Lee.
Thank you very much. It is my honor to be here today. My name is Won Jae Lee from Seoul National Bundang Hospital. I'm an interventional cardiologist and the Deputy Director of Internet Healthcare Center, and also the Chief Medical Officer for the Health and Cloud. Let me share my slide first. So the projects really go back to 2021, when the president of Colombia, Ivan Duque Marquez, paid a visit to South Korea to explore innovative country-to-country cooperation program for possible implementation. And impressed by his approach to virtual surgical education, and Dr. Sang Jun, director today, was invited to Colombia to have more discussion for the cooperation. So the project objective of this is that we aim to provide the best expert advice to patients suffering from severe conditions in communities with limited access to healthcare. And at the same time, we would like to provide higher level education and conference for Colombian medical experts as well. So today is a kickoff meeting, and we expect to start our project starting next month. So these kind of projects empowering the healthcare system is not easy. And we think that it cannot be done by one medical institution or even a country, or definitely not by a single company. We think that it needs collaboration across the area. So for this project, there are top medical institutions from Colombia and also from Korea, including Asan Medical Center, is participating in this project. And also a leading technology companies in Korea, like best top-tier IT company like AGCNS, a genetics company Macrogen, and proteomics company Vertex. And also laboratory leading company Samgwang is participating, along with other startups as well. So we think that this is a true collaboration of top-tier medical institution and also the technology partner to empower the healthcare of Colombia. This project really comprises of two parts. The first is telemedicine. But telemedicine, what we're talking about, is not just a video conference system that we already have. We want to have, when necessary, a virtual 4D clean room, which will integrate into a platform to make the environment more immersive and interactive, that patients and doctors can communicate much more effectively. And not just video conferencing, we'd like to integrate the proteomics data, genetics data, and all other lab data integrated to here, so that we can really provide the whole spectrum of treatment. And second part is that Metaverse Library. So through this project, we aim to create a so-called Netflix for healthcare. So we have not only the top-tier hospital, but backed by Smart Hospital Alliance hospitals across the world. So we can provide not only just 2D images, but also a immersive program such as interactive contents, metaverse faces, training content, so that we can provide really a one-stop service for Colombian and also the Korean medical experts as well. So without further ado, the project manager of this project from Health and Cloud, Mr. Dowding, will go into details and the roadmap of this project. So I'm going to hand my mic to Mr. Dowding. Thank you very much.
A continuación se dirige a ustedes Mike Dowding, gerente del proyecto y quien presenta el mapa de ruta del proyecto.
Sorry, bear with me while it's loading. Okay, so Health on Cloud is not really a company, it's more of a vision. It's really about combining medical education and virtual healthcare in a collaboration with all of the world's best. Everyone's entitled to good healthcare, and together we can make it happen. So a little description of how a lot of this began. This is not recent, this is years in the making. We have Dr. Sang-Hoon Jun, who's with us today, who is very ambitious, and he doesn't stop trying to find a way to innovate or teach or educate. He is the president of the Asian Society for Cardiovascular and Thoracic Surgery, but much more. He does as much as he can in Asia to teach and inspire young surgeons and medical professionals to try to get the best out of each. Through that network, we have Dr. Unsum Park, who is a thoracic surgeon, but is also leading in nursing education in Korea. Very passionate about education and wants to bring everything from abroad. We have Dr. Anis Ahmed from Singapore. He is also a thoracic surgeon, robotic specialist actually in thoracic surgeon, but also a leading nursing educator all throughout Asia. Everyone you'll see today, you'll see are passionate about education. We have Dr. Ralph McKinnon, who you met today, as the chair of the Smart Hospital Alliance. But what he didn't say was that outside of an anesthesiologist at the Royal Manchester Children's Hospital, he's been driving a simulation network that combines all the leading hospitals around the world, from the US to Europe to everywhere. He's been doing it for quite some time with a lot of innovative people where their ambition is basically education. Then we have Sergey Kim, who you've also spoken with, who also works in international medicine at Seoul National University Bundang Hospital, but has been driving a lot of cooperation in CIS countries like Uzbekistan. He also initiated with Dr. Jun, they educated more than 100 CEOs in Moscow. When Moscow decided it needed a change, they actually fired 100 CEOs and they helped to train at the hospital, showing their dedication to actually running healthcare and educating those in need. Together, it's about assembling an R&D circle, which is what we've been doing. The vision is as you see here. It's a metaversity and a cloud hospital, but they're both kind of hand in hand. Today, a lot of programs due to COVID were forced to go online, and medical education can probably benefit the most because traditional medical education is tough. Normally, people will be educated they would go through their medical school, then they would go to the hospital, and sharing is very difficult. Your pool of surgeons are very small, they're surrounded around. But by using these digital technology and platforms of video sharing, you can really expand knowledge share. And then the cloud hospital. Why can't someone get consultations from the world's best no matter where they are? You can talk to your mother, your father on a call. Why not talk to a doctor that can help? Why not? So the Smart Hospital Alliance, you've heard a lot about it, and that's happened, and it was initiated in 2021. It started with a trip to the UK that helped us rally a lot of the UK's health organizations with the NHS, which is the MFT, which covers about 12 hospitals, Northern Care Alliance, which is another 4, recently Alder Children's Hospital, and then into Seoul with Assam Medical Center, Seoul National University, Seoul National Bundang Hospital. We've been working with Singapore with NUH Hospital, LA Children's Hospital have been collaborating in trials all over. It's an R&D circle where we try to go to hospitals. Every hospital has about 3% that are really into innovation and they want to make a change. We've been going around trying to focus on those people and to bring them together and give them hope of sharing resources and making change happen. So moving on to the project, Empowering Colombian Healthcare, Feasibility Study. So we have objectives. We're not, it is a study. We don't expect to reinvent the wheel initially. What we want to do is lay a solid foundation. And we're setting our sights primarily on reliable and interoperable. We don't want, not one person can do this. We need a lot of partners to make this happen and collaboration and the technology, just in the technology aspect. Instead of using just one, we want to incorporate some of the world's best and develop it together so that people have access to the most innovative technology, not just what one company offers. We want user-friendly and capable of application expansion. What we aim to do should be expandable. It starts here, but why can't it be global? We set a standard, we set a roadmap. Strong cybersecurity and easily protected. That is very important. As many rules are being written currently, no one really anticipated the idea of remote technology serving people medical education. So it's very important that we follow the rules and we make sure that we check all the boxes. Accessibility for multiple devices. When we first started this, we tried things like VR headsets or PC, and what we learned is it has to be accessible on everything, depending on the country and what they have access to. Some people might have everything, but some might only be able to afford one thing. So it really depends. So accessibility is extremely important. Reliable and trusted. This is medical. It needs to be trusted. And effective and non-intrusive. We want all medical professionals to use this. We don't want it to be cumbersome and not easy to use and user-friendly. It needs to be usable. So for the project layout and proposed structure, as you've heard tonight, we have Health and Cloud in the middle, but that's not really just Health and Cloud, as we mentioned. That's all of the partners, that's all of the global collaborators that we want to bring into the Columbia system. The main focus is the rural hospitals, the people that really need it. And again, we're going to start with the major core hospitals and try to branch out to 4 rural hospitals. Obviously, we want to go further than this, but we don't want to go too big too soon. So in order to do this, each hospital will recruit a project manager, a technical lead, a medical lead, and legal and regulatory advisor. It's important that we tick all the boxes before we move on, we make no mistakes. So as mentioned in the first, teleconsulting. So as you can see here, this is not the actual images. This is what we intend to put together. As you can see here, a normal telemedicine platform is great, but to actually consult and give an expert opinion, you need access to EMR, medical records. You need access to a fax viewer. You need to see images. It needs to be important. And you can't have delays. For a patient that's going through a traumatic experience, you need to deliver a very good consultation. So this is extremely important. But what we intend to do is not so much a global expert coming in and telling a patient what's happening. The way we see it is, it's doctor to doctor, doctor to patient. So our global experts will advise the doctors, not consult the patients. Together, they will also educate those doctors on why they do that. In a lot of cases, something simple as reading a scan is not so easy. To someone, for example, like Dr. Jung, he can look at a scan, he can identify something relatively quickly. To someone who's novice, maybe not so much. It'd be hard to read that and understand what needs to happen. So that's what we intend to do with this. These areas of focus is something, it depends on what the rural hospital will need. This is our goal, but this may change. So cardiology, because obviously we have access to a lot of the world's best heart surgeons. Oncology, because it's important. Cancer is severe and it needs to be addressed. Pediatrics, not every country has a great pediatric system. And it's not always good to put kids in a situation of an adult environment. It can be scary. So proper pediatric care is very important. And neurology. This is just an example of some of the consultants we would use, but it's a global network. Ideally, what I want to point out here is you'll notice, I have pages of this, but you'll notice that they're all at the top in their field. And that's what we aim to bring. The virtual medical education, the most important thing. I recently did a project, I guess, a test in India, where I interviewed 100 surgeons, and access was the most difficult thing to overcome. A young surgeon would graduate from medical school, and how do they get their fellowship? How do they learn their innovation? There's no easy way of doing it. You can't just go online, you apply, you don't know anybody. It's a very difficult process. But in the case of online medical education, a great educator can educate many more. So this is the MEDIS platform. It's already been constructed, and I'm going to show you a little video to demonstrate it that I've prepared in Spanish. Oop. Apparently, it won't play in this mode, so I'll skip the video due to time, and I'll talk about it. Okay, you saw earlier about the videos. What we've been working with a lot of these core Smart Hospital Alliance partners is creating content. So you can have a surgeon, for example, in the UK, who's cutting edge of one thing, and someone in Seoul, where they can create educational videos, immersive videos, that would be put up on display. So surgeons can really get in there and learn how to do that. But it's also built like a university. As you can see here, courses can be constructed, tests can be given, organization, products, everything can be managed. Again, this video won't play, so I'll describe it. So over here, we have a test, customizable test that will be issued to students that each doctor can change in any language. And these will be video presentations where in this case, we have an AI avatar where you could select a language and they would deliver it in yours. Now, this is not something we've created. This is a partner we're working with so that it's more interactive and immersive. It's really hard for a medical student to watch something that's not in their language and actually absorb it and stay interested. So we're trying to address issues like that. This is a video, but it's a screenshot of the video. As you can see here, this would be a video that could be in a VR headset, or it could be 2D, where essentially it's designed so that everybody can see what's going on in the room. The nursing staff, the support staff, the surgeons, you have your imaging, you have an endoscopic camera view. They see everything that's happening in the surgery. And this actually started at Seoul National University Bundang Hospital with the Smart OR, which was dedicated to education. The final phase, what we see, and I won't build on too much, is future. This is what digital can do. With each new application and world-breaking technology, you can add and expand. So if there's a new AI device that helps neurology, helps read a scan, it can be shared in real time. It can be trialed amongst the group. And a hospital in a rural area that can't afford the latest technology or medical device will have access to the digital, which is where the world is going. Thank you.
En este momento hemos finalizado las presentaciones del proyecto y tenemos algunos minutos para resolver algunas preguntas. Agradecemos si alguna persona presente desea hacer alguna pregunta, a favor indicarme para pasar el micrófono, y las personas conectadas virtualmente pueden levantar la mano.
No, la formación en medicina es muy regulada por los estados. La pregunta que tengo es, supongo que esto es un complemento a la formación médica que hacemos en las facultades, o se piensa construir programas no necesariamente, o cursos de formación completamente virtual. It's a complement of the formation of the school, or is a different kind of formation?
Thank you very much. We are focusing not only for medical experts in postgraduate education, but also we will provide the very undergraduate lecture materials. For example, the nursing school. So we'll provide the curriculum-based, for example, adult nursing 3 credits, nursing pathophysiology 3 credits. It is very fit to undergraduate students. For the postgraduate, the young doctors and young nurses, we will provide mostly by simulation process based, and the expert surgeons, expert professors, we would like to deliver world best cutting edge technology. Depend on their level of the practice and the education, we will customize. And especially for the undergraduate students, all the languages should be provided by Spanish.
Muchísimas gracias. Mi pregunta va encaminada si también se va a extender esta propuesta a investigación biomédica básica o aplicada.
Thank you. It is more than important. We are focusing not only for the critical excellence and education, the third one. The third 3 important priorities is the biomedical research. So yesterday meeting with the Santa Fe, and the day before yesterday, Javier Hospital, every doctors, every professors are keen to research as well. So in this project, we will deliver the clinical consultation, but during the clinical consultation, we need to do the basic research together with and writing paper together, trial together. I believe it is very, very important in our project. Also, the Colombia and the South America has a very excellent resources, South America specific. For example, tropical disease is a very unique disease in South America, Amazonian area. We would like to do collaboration by genetic analysis we can set up the tropical disease genetic center here in Colombia. And then all the global pharmaceutical companies should come to here to develop new drugs. It will be, I think, very important translational research. Thank you.
Yo solo quiero hacer un comentario, y fue la experiencia que se vivió en medio del COVID-19. Si hubiéramos tenido una herramienta de estas, yo creo lo que hubiera pasado. Yo recuerdo que Corea, en el marzo del 2020, Corea fue de los primeros países que hizo una videoconferencia con el Instituto Nacional de Salud, con los mejores médicos acá encargados del sector y los médicos que estaban y las dudas que existían. Recuerdo que tuvimos que traducir del coreano al español de varios hospitales coreanos cómo era el tratamiento clínico. Entonces yo creo que esto es una herramienta y una ventana de oportunidad a algo que se nos puede presentar en un futuro. Muchas gracias.
Cerramos la ceremonia agradeciendo la participación de cada uno de ustedes y antes de irnos deseamos hacer un registro fotográfico de los presentes y de quienes están conectados de manera virtual. Agradecemos a los organizadores, a las personas que están en Corea, que iniciaron muy temprano su día para unirse a este evento y a todo el equipo de trabajo en Bogotá por el esfuerzo para hacer de esta alianza una realidad. Mike, can you help me please with the people to get their video on?
Gallery. Yeah. There we go. Okay. Could you please all turn on your cameras if you are there so we can all join in the picture? Thank you. I believe that's it. Some of the others may have had to leave.
Vamos a pasar adelante. Bajen otra vez.
Hello, everyone. I just wanted to let you know we're going to close the meeting. So everyone online, thank you, and we'll talk to you all very soon. Goodbye.